Hello, my name is Sophia Matovu and I'm down in Lira City. But in Lira City, I made an effort to go down, deep down in the village, to a place called Amorel. You might be asking yourself, what am I doing there? You have heard, I guess, about palliative care. I thought rather than sitting down on the desk or rather than sitting down in the studios and having this conversation, I would rather come down to the field and let the story speak to you. Here with me in this homestead, like you can see, I happened to come across a young boy who is a caregiver at the age of 17, but even before he made 17, he has been taking care of his mother who is partially blind. She's living with HIV but needed palliative care services, and his younger brother. Listen into their story. Child-headed families. The 2016 National Household Survey shows 24,063 children-headed households in Uganda. In homes where parents are severely ill and need palliative care, children are often the primary caregivers. With no money, the child quits school to earn a living while caring for the dying parent.
In 2014, my mom is not okay. She's having HIV positive together with my brother. So that time, my parents, which is a father, is not there. Again, my mom she's a blind person. So I was even still young, but I had to take care of her together with my brother. In case of any sickness, I travel with her to the hospital, footing there and then, doing all those things. And from there, when we are at home, I have to go to the hill there to make some money, to come and make sure that home is going on well. But I went through some few challenges, even where we were staying, which is where we are in right now. People who are here, they treat us like just like street children. But we keep on praying that God, please, if times allow you, make us to be somebody, that to make our life be well. But I kept on praying.
Tonny, the brother who is called Gerald, was admitted in the hospital. By then he was a small boy, not as tall and big like the way you are seeing him. The mother also was referred to us. We used to walk in every ward to identify palliative care patients. And when we would identify them, of course, we bring them to the unit and we sit with them, talk with them, counsel them. We have a form for assessment. So we had to assess Gerald and the mother. The mother was also enrolled because she had a lot of pain to the services for palliative care. That was 2014. And the assessment, you know, with palliative care, once the patient is tired, the first thing you do is to relieve pain. And then you start, once the person says, next time, you make appointment, then another time. So that is how we got to know the mother and the two children. And on assessment, we found that they were in need. They were in the greatest need compared to all those other patients. Even some of the transport money we used to come with, we had to give them because they would come. The young boy is hungry, there's nothing to eat. You ask, they have not eaten at night. Are they studying? No. Tony's hand, if you would touch, it was like this wood here, very hard. We asked him, what are you doing? He says, for me, I go dig in people's gardens. That is how I support my father. Because he was now a husband, a father, a brother, everything to the mother, to the brother, and to himself. So he would even go to the quarry to hit aggregates and sell. And of course, it's not always a lucky day. There are days when they would go without it. So on assessing, we found they were in need. And we even made sure we had to come here.
In 2014, And then we met Sister Phil in their regional referral hospital. By that time, my brother Gerard, he was sick and he was admitted in the hospital. I stayed there with him for at least, if I'm to remember, I think 2 weeks. Together with him, we had nothing like bed sheets, mosquito nets. I slept on the floor there. But by God's grace, by that time, God did something which is very good.
The Road to Hope program supports child caregivers from financially poor backgrounds to access basic needs for their families and continue with education while caring for their chronically ill parents. The Palliative Care Association of Uganda, in partnership with the Center for Hospice Care under the Global Partnerships in Care, established the Road to Hope program in 2012. The children are identified in collaboration with palliative care practitioners, especially in the rural districts of Uganda. They have cared for or are still caring for their chronically ill parents, while at the same time are burdened with the responsibility of fending for the family, a role the parent can no longer fulfill. They often walk long distances to receive their parents' medication. Child caregivers are forced to do odd jobs to get income to support their families, which does not leave them much time to focus on their education. The Road to Hope program relieves them of this burden. Once identified, children are enrolled in schools within their districts to enable them continue to get additional community support. Their other needs, which include financial, social, and psychological support, are taken care of by the program.
In 2015, they connect us to Palliative Care Association. In 2016, I started study from P1, but I was big. Now, by that time, I think I was now already 13 years. But they asked me, that Tony, do you want again to go back to school? I say yes, but only that I don't have money to go to school, but I want to study. And then they took me to study. I started studying in 2016. Again in 2017, my brother also joined. And I give thanks to God. If somebody come, that Tony, please come and help me do this. I go. Then after that, that little money which I receive, I use it to make sure that home is going on well. By that time, I don't have any money. For me, I just take my brother or my mom, in case they are sick, to the real regional referral, because from there, they cannot pay money. But in case any sickness which is tough now, I don't have money to take them maybe to clinic. For me, I just go straight there. My mom, she's blind. Again, my brother also had HIV positive together with my mom. Everything I have to do, because my brother was also still young. Everything I'm the one to do. From there, even I think of, I don't know how my future will be. So sometimes I can cry, but my mom said that, please, don't do that. God has something for you. Just keep on praying. And then my mom keep on talking to me. Even some people who love us, they come and talk to us, encouraging us.
I'm Richard Opio. I'm a teacher by profession. When I came here in 2010, it was the time I met him. He was still very young with his last brother. So they were there together with the mother. There were three there. When I found them, in fact, I saw that they needed some help. Generally, counseling, advices. So I started being close to them to guide them to love studies, to be in schools. And they accepted, although there was difficulty. They had no one to pay for their fees. And the schools in our locality here had some little to be paid. But they would go to schools when there is time for demand for fees. Sometimes they drop out. Sometimes they stay there. So I keep on advising them not to give up. So they continue like that. And in terms of feeding, sometimes they would get difficulty. And when we have something, we support them. Unfortunately, the younger brother would fall sick from different ailments like malaria and others. And sometimes we also come in where we can. We advise them to seek medical help. Sometimes we give them bus call to go for treatment, especially the elderly brother, Tony, to take his younger brother to hospital. Sometimes their mother would be down, and we would also come in to see that she gets some help. And we would also see that she seeks medical attention. And we keep on like that.
In 2018, I was in primary. I was supposed to go to primary 4. Then they took me to boarding school. From there up to now, I haven't seen any misconduct or from my friends. They cannot abuse me or what. Because from there even I can behave well, all teachers like me, so I did not add anything. And I'm enjoying my study together with my brother. Even from school there, they can allow me to communicate to my mom. But sometimes I can get worried because maybe she's had nothing to cook, do what. But even this holiday I came, I was thinking that I'm coming to find her or maybe sick, but I came and found my mom very healthy and she was just happy. Actually, by the time we joined Palliative Care Association, up to now, of course we face some challenges, but up to now I'm very happy because there are so many things that Palliative Care Association they have done into our home. And right now I can see my future, yet I have not yet seen. Like where we are staying, here people don't love us. Even time came and they say that they don't know us. We should go and find our place in a street there. But I told them, please, give us time. God will give us something and we'll leave your place. In 2020, they came and bought for us a piece of land, just a piece, but it's very important because they bought for us. Again, this year I came back from school. I was very happy and I give thanks to God. I found that our house, they have already started construction and construction is still going on.
So this is the house for those of Tony and Gerald. We decided to put 3 rooms. This room on this right-hand side belongs to their mother. And we are going to put metallic door, a window, and this place a wooden window. Metallic window for safety. This is their sitting room. Here we'll have a metallic door so that when she locks herself, she's blind. She locks herself, safety. This 3rd room here is for the boys, Gerald and Tony. One bed can be here, one bed can be here, and here is also going to have a metallic window so that They don't have, everywhere there are wrong people in society, so that they don't have access to enter in. But all these sides that are finished, we are going to finish it. And then we are going to make a proper ramp because their mother is blind. She needs a ramp for movement. We network even with Palliative Care Association, even with hospice. When we find there are things which we cannot manage, we ring the people of hospice. Also when they are sending patients, referring to us, they ring, and then now I go with them to the palliative care unit. So I ran quickly to Palliative Care Association because there is this project of helping, paying school fees, and they want carers who are looking after the sick people. So he was the main carer. So that is how I contacted them. We had to contact the LC1, what have you. That is how I located this family. And I found they were in total poverty. I would call it acidic poverty, abject poverty. You would see it on their face, on everything. But I want to thank God that now they can smile. Now they are happy. Now they can laugh. It was difficult to find a smile on their face, to laugh, to do what? Because God has been faithful. For sure, I said that was God. What was paining the mother? The mother was like, for me now, if I am to die, where am I leaving my two children? Where are they going to be? That was her main worry, because that is the question they ask. What is your main worry? She said, now supposing I die, my children, where will they be? No land, no nothing. They are being called corridor children.
Currently, the Road to Hope program supports 58 children from various districts of Uganda, that is in Arua, Yumbe, Moyo, Masaka, Hoima, Jinja, Lira, Buyukwe, Chibale, Luka, Mayuge, Tororo, Ruwero, and Kayunga. Tonny is one of the beneficiaries of the program.
So I give thanks to God. Not only that, during holidays like this, they usually give us food stuff. Even when we are at school there, they give us even pocket money in case anything is missing, we can get it. But I'm very happy. And there are so many things they have done that I did not mention, and I think yet are still to be done. What I can tell my friends is, whenever you are facing some challenges, though your parents are not there, in everything that you are going to do, you must put God first and let God be your helper and pray to God, because God has everything for us. And even if you are going through difficulties, don't think that you are useless, because you don't know what you will be in future. That is the only thing I can put on to my friend.
Need I say more? I think Tonny has said it all. He's got such a sad story, but what I found quite touching in his story is that he still did not give up on education. He was not ashamed to be laughed at, much as he's 17 years old, to still be that he's in primary school. But thanks goes to Palliative Care Association of Uganda for coming in to support this boy. Not only did you provide the palliative care support to the family in terms of the mother's physical well-being, but you also went ahead of one of your programs to see to it that these young boys are enrolled in school. What better way other than now to say thank you so much for giving the boy a ray of hope, for giving the family a ray of hope, for constructing a house for them. Thank you. you.